Good evening, everybody. Welcome to today's series on sexuality health education, that is smoking and erectile dysfunction. Can smoking affect erectile quality? Smoking, blood vessels, endothelial health, cardiovascular risk, and ED. We will dive into the topic. Why blood flow matters. An erection is a neuromuscular event and requires an appropriate increase in penile blood flow. Healthy endothelial function helps blood vessels relax during sexual stimulation. Vascular disease can interfere with this response. That is why erectile health and cardiovascular health are closely connected. The vascular pathway. How can smoking affect erectile health? Cigarette smoking in turn causes endothelial and vascular injury, that in turn causes reduced vessel relaxation and leads to impaired erectile response. Smoking and endothelial function. Cigarette smoking associated with heart and blood vessel disease. Research supports impaired endothelium dependent smooth muscle relaxation as one mechanism linking smoking and erectile dysfunction. Reduced vascular responsiveness can make adequate erectile blood flow more difficult. Smoking is therefore a modifiable risk factor worth addressing. Smoking often combines with other risks. Diabetes or elevated blood glucose, high blood pressure, abnormal cholesterol, overweight or obesity, physical inactivity, established cardiovascular disease. Look at the whole patient. Is erectile dysfunction only a sexual performance problem? Not always, but most of people think like that. Persistent erectile dysfunction can coexist with broader vascular and metabolic disease. Sexual health assessment may provide an opportunity to revive and review cardiovascular risk factors, medical medication, lifestyle, and psychological contributors should also be considered. Do not assume smoking is the only cause simply because the patient smokes. Can quitting smoking help? Smoking cessation is recommended for overall cardiovascular health and is part of erectile dysfunction lifestyle management. Some evidence suggests that erectile function may improve after smoking cessation in some men. Improvement is not guaranteed and depends on the individual's overall health and established vascular disease. Quitting remains beneficial even when erectile dysfunction requires additional treatment. What should be evaluated? When did the erection difficulty begin? Is the problem achieving firmness, maintaining it, or both? Smoking amount and duration, other nicotine or tobacco exposure, diabetes, blood pressure, cholesterol, weight, and cardiovascular history, medications, morning erections, libido, stress, and psychological factors, focused examination and selected tests when clinically indicated. When should you seek medical advice? Erection difficulty is persistent or recurrent. There is progressive reduction in erection firmness. You smoke and also have diabetes, hypertension, cholesterol problems, or cardiovascular disease. Sexual desire or spontaneous erections have significantly changed. The problem is causing meaningful personal or relationship distress. The practical health message: if you smoke, quitting is one of the most valuable steps for cardiovascular and general health. Combine cessation with physical activity, healthy weight, and appropriate management of BP, glucose, and cholesterol. Avoid unverified sexual performance products and inappropriate self medication. Persistent ED deserves individualized assessment even after lifestyle changes. The take home message is yes, cigarette smoking is associated with erectile dysfunction. The connection is strongly linked to vascular and endothelial health, but ED is often multifactorial, so smoking may be one of the several contributors. Quitting smoking benefits overall health and is a part of evidence based erectile dysfunction lifestyle management. Confidential education and professional. Continue your men's wellness education. Subscribe for evidence-based men's sexual health education. Complimentary 2-minute men's sexual wellness self-check. The link is in the YouTube description. Instagram @sexologist _ Dr. Karthik DM for self-check. Educational content does not replace individualized medical consultation. That's all for today. Tomorrow we will meet you once again.